The Needle Exchange Program by Gianna Aversa. An overview of the Needle Exchange Program. The Needle Exchange Program reaches to reduce the substantial risk involved in getting and transmitting HIV and other blood disease by providing people who inject themselves with drugs sterile syringes for every injection. These programs may take place in program-ran residents and through pharmacies. It is a community-based program and is free of all cost for all drug users. It is not to encourage them to keep using, but to encourage them that if they do use, they should be using it in the safest way possible. The Needle Exchange Program should be implicated in every state because it helps drug users in the community as a whole by lowering the risk of HIV and offering support. The CDC claims that the Needle Exchange Program offers other prevention materials and services such as education on safer injection practices and wounds care, overdose prevention, referral to substance use disorder treatment programs, including medication-assisted treatment and counseling and testing for HIV and hepatitis A. There are many positives to the program. There are also many social, cultural, and organizational factors. With the stigma around drug users and the recent epidemic in opioid overdose, there are growing social, culture, and organizational factors that coincide with the Needle Exchange programs. Injecting drugs is illegal in the United States. There is a negative stigma around them because of the dangers that they induce. Therefore, users are harshly punished. This contributes to keeping the social organization of drug users limited and underground. Without needle prevention programs, drug users are forced to stay far away from the social aspect of society. This is a benefit for families who choose to keep their children away from drugs, but is harshly negative for the drug users who become outcasts of society. The Needle Exchange Program can minimize, if not abolish, the risk of HIV, AIDS, hepatitis C in local communities. This would benefit the social aspect in not only drug users, but people who are sexually involved with drug users, and all of their social aspects in their lives. Injecting drugs is responsible for 1/3 of AIDS cases and 2/3 of hepatitis C cases. Syringe exchange programs, in which injection drug users exchange used syringe for sterile ones, can address potentially rapid increases in the rate of HIV infections in this population. If a sufficient number of sterile syringes are supplied, users can inject with a new syringe each time, dramatically reducing, if not eliminating, the sharing use of syringes. Dirty needles are the leading cause for contracting these viruses, so replacing them would decrease the rate prevalence. On top of the social impact, there's also a positive economic impact with the Needle Exchange Program. The state pays for the medical treatment of HIV-infected individuals through taxes from all citizens, so the more people who need treatment, the more money is being taken out of citizens' wallets. It is estimated that the Needle Exchange Program in one county will prevent 24 cases of HIV over the next 5 years. This saves $1.3 million that are taken out of the HIV funds. This translates into a ratio of cost savings to cost 4-to-1. Estimations say that they would be paying 1/4 of the amount they are now to treat HIV. The cost for treatment of viruses that coincide with sharing needles is extremely large. The implications of these programs could save taxpayers a great deal of money in the future. Needle exchange programs are cost-effective. The average syringe costs 97 cents, which means the program can save money in the whole population where HIV exists, 2.1 per 100 persons per year. The cost to prevent HIV infections is estimated $4,000 to $12,000, which is considerably less than the estimated $190,000 medical cost treating one person who is infected with HIV. There are still political ramifications on the program. Many citizens do not believe that using federal funds to support the Needle Exchange Program is right. They believe that it contradicts illegal drug use by giving users permission to use from the government. People who believe in this point of view the funding of the program as a doorway to drug use for many people, even if they were already using prior, by saying the government will now pay for them to use. Many people with this view claim that federal funding of the Needle Exchange Program and the unlimited availability of sterile needles could cause a rise in drug abuse, overdose, and diminish public health. The The citizens with a negative view of the needle exchange program assert that federal approval in the program and removal of a large obstacle that once stood in the way could corrupt the influence of children who are near these programs. But on the other hand, there are members of the government and community who believe the needle exchange program has more beneficial outcomes than negative effects. The most important reason behind their decision are that these types of programs increase the availability of sterile equipment that users use to access drugs into their bloodstream. They remove contaminated needles that potentially spread viruses such as HIV from the circulation among. The main purpose of these programs is to put an end to the rise of HIV and to prevent the overdose among drug users and those who surround them, which is beneficial that accumulates to benefiting the community as a whole. There are typically health professionals at these services, such as educators, trainers, who teach drug users about the risk involved. This gives them the opportunity for treatment and supervises them while they are making sure that they stay clear of overdosing. The people who are most likely to benefit from the needle exchange program are injectable drug users and their sexual partners, but the community as a whole will benefit because of the economic impacts and the health impacts that the needle exchange program will provide.